Sounds good. Okay, welcome everyone. I'm Dr. Brian Nada, and I own and operate Nada Chiropractic, also called Elevation Health. And I've been in private practice for 25 years. And so part of my mission by doing this webinar today is I go out into the community to teach about health and wellness from more of a proactive or preventive mindset, rather than just being reactive. Now, the problem is when people wait for problems to happen, wait for pain, sickness, illness, or disease, they typically enter a system, a traditional system of drugs and surgery, which has its own issues. And so I'm here to offer you a different approach here. And certainly we're going to talk about scoliosis today. The definition of doctor is teacher, and educating, I find, is not enough. But getting people out of awareness and into action is never easy. And so I hope to set you on a better path and perhaps inspire you to take some action in regards to your health and well-being. Now, the subject today, of course, is scoliosis. And we're going to be talking about that during this particular time, the effects of the pandemic. Now, before I do that, I just want to show you a slide here on disclaimer. So again, this is something that you can look at again as a disclaimer. We call this a disclaimer alert. So just make you aware of that before we get into the body here. So again, the effects of the pandemic, we still need to be being aware of our health. And so a really important part of our health is our spine. And so one of the conditions that we find that people have and can affect young and the old is scoliosis. So June is actually Scoliosis Awareness Month. And so we aim to help you understand this better today. And the reason you logged into this webinar is you may have a family member or maybe even yourself has scoliosis, or you just want to learn more, spread the word about it and the non-surgical treatments that are available today for it. So looking at the basics here, when we look at an x-ray, looking at an x-ray from behind on this slide here, the spine is supposed to be straight, right? So you see it's curved. Matter of fact, there's two curves there. So it can be many causes. It happens more in girls. It starts between typically the ages of 10 to 12 years of age. It's called idiopathic 80% of the time, which means that there's no underlying or pathology or disease process that's causing it. It's the spine growing in an asymmetrical way, leading to the misshapenness and the crookedness of the spine. So part of my job would be to rule out some of these other potential causes. Now, as the child and the adolescent grows, it can worsen during the growth spurt, the growth phase. So we do want to monitor it, certainly, and probably need to treat it with spinal care rehabilitation or even something called scoli bracing. And so the adults now, they can have it too. And we're going to take and talk more about that as we go along here in regards to the adults. It's less known that adults can have it as well. So the bend, as you look at this person from behind, the bend greater than 50 degrees, measured geometrically. It's called the Cobb angle measurement. That's the most concerning if it's over 50 degrees. It gets worse by itself. You have the weight and the effects of gravity compressing and coming down on that spine from the top to the bottom, and it compresses it further. So, but if it's under 50 degrees, a little less so in terms of the compression, and if it's under 30 degrees, a little more less so as well. Many patients are concerned with how it looks. And if you look at that spine there, aesthetically, their self-esteem, their relationships with other people can be affected. And so we understand as clinicians that beyond the x-rays, patients are concerned with how their body looks, how the posture looks as well. We understand that if we detect scoliosis early, not only can we get the curvature from getting worse and those curves getting worse, but we can often improve the look of the spine, the body, the posture, the shoulders more level, the waist more symmetrical and more level, and the rib cage looking better as well. So that spine getting straighter again. So doing something early and having appropriate treatment, not just for the progression, but also, how you look as well. So Scoliosis Awareness Month. It's not just what the disease is here we're talking about, but who can be affected by scoliosis and recognize the signs of it. So how to actively have a look, right? To really notice this in people and even yourself. And even in the older adults, you might be seeing that they're shrinking or that they're really stooped over, bent over to one side, really bent over, looking from the side, very stooped over posture. It's called hyperkyphosis. And this is all leading to and developing what's called an adult degenerative scoliosis. So what if your loved one has scoliosis? Well, not all treatments are the same for sure. You go to a clinician that has specialized training in the scoliosis treatment, especially the more advanced ones of today. So scoliosis does not discriminate. Actually, the most common population with scoliosis is the elderly. So 30% of the population over 60 has some form of scoliosis. Now, some of those had it from childhood, about 5 to 10% of them, but most develop it after the age of 50 or 60. Now, this is called a degenerative scoliosis. So now, just like with children, we can also have good treatments and management and positive outcomes in the older group and get them a better quality of life as well. Scoliosis. Scoliosis is definitely a problem for all ages here, but can run in families as well. So if you have it, or you need to recognize, or maybe you need to recognize your children or other family members, maybe cousins might have it as well. So rather than burying your head in the sand, be proactive and getting it checked. Okay, so prevalence increases, especially in girls. I'm trying to shut the video off. Prevalence increases, especially in girls, when they're going through their growth spurts. Okay, so it's important to check your daughter or granddaughter, and especially if there's a family history. More commonly, scoliosis can affect adolescents, but can also occur in juveniles. That's the 3 to 10 age group, and rarely in infants as well. So idiopathic. Idiopathic refers to unknown origin. Okay, we don't know the cause. But we also want to rule out other less likely reasons for scoliosis that could be more serious. So idiopathic is about, again, 80% of the time means there's nothing else going on, for example, a tumor or other manifestations. An adult could have had a scoliosis as an adolescent or may have started later in life. So here's the problem. If the spine is not in proper alignment, in the proper positioning, it can wear out faster. It's more unstable as you age, and the adult or the older adult can experience a lot of accelerated degenerative changes or arthritic changes, and in the joints there, in the spine, other joints of the body as well, creates intense instability, pain in the lower back or the hips, down the legs, mobility issues. So it's cosmetic as well, cosmetic or aesthetic, again, how it looks, or postural changes. It looks crooked, looks hunched over, and again, just doesn't look good. The spine bends or twists. It's not as strong anymore. People may get shorter also as they age because the spine is degenerating faster. That's the reason. And often because the spine is curving, and that's the reason why it's degenerating faster. So it's a sign they may have scoliosis, and it's getting worse. So we need to know how to detect it early, right? So we can give the most appropriate treatment and get the best result. It can often allow the person to not get to the point of surgery. So curves larger than 50 degrees, again called the Cobb's angle measurement, looking from the front or the back, or larger than 80 degrees, looking from the side view, they're really stooped over, you have to start considering surgery as an option. Because if you don't stabilize the spine, it will continue to worsen and break down more. And you really don't want to let it get that severe, okay? The best situation is stopping it from ever getting to that point. And we can most times reduce the curves, especially in adolescence, and get the older ones more stable, more mobility, less pain, and to look better, improve their quality of life. So grandparents, grandparents, I have, they say to me that, I have such trouble walking, or they can't lift up their grandchildren anymore. They're not enjoying their gardening, they're not enjoying their traveling anymore, all because of these issues there. So giving the older adults scoliosis specific care and maybe a low profile, low impact brace to get the quality of life back. So this comes from the Scoliosis Research Society. It's the world's leading scoliosis research organization. So they say that the earlier the detection, no matter what the age, the better chance to manage it without surgery. So this is actually a group of primarily surgeons who are really looking to reestablish the scoliosis screening. Unfortunately, in the late 90s, early 2000s, scoliosis screening was abandoned by most of the countries and in the United States, most of the states there as well. It even used to be in the schools. But now it's being realized that the non-surgical treatments available today, scoliosis-specific exercises, and the three-dimensional analyses that are available today, and the overcorrective 3D bracing not only can help pain and function, but get much better outcomes and better results. So in terms of recognizing the signs of scoliosis, now it's important that we screen effectively. So someone who has a high shoulder on one side may or may not mean that there's a scoliosis there. So a trained doctor who can provide the right tools to investigate accurately. Now, Scoliosis Awareness Month, again, is in June. It's leading into summer, June, so it may be easier to see some of the signs of scoliosis. So let's look at some signs and then give you some other tools, perhaps, to help you quantify it. So looking from behind. Let's go to the left picture here. Looking from behind with minimal clothing, a bathing suit, exercise apparel, sports bra. Of course, the guys can have the shirt off, but because you have to see the shoulders, you have to see the shoulder blades, the skin folds in the blades in the waist area. So you have to be able to see these things. You have to see the asymmetries that are there. So let's look at number one on the left. Number one is the low shoulder, the low shoulder. So you may see that the shoulders are uneven. The one on the left is lower than the one on the right, okay? So number two is the shoulder blade. So you may notice that on the right, the shoulder blade is sticking out more, indicating a rotation of the spine or the rib cage on that side. Scoliosis is a three-dimensional issue, not just shifting, not just from the side view and going front and back, but also a rotatory component, a rotary component. So you're seeing that rotation number two going backward towards you on that right side again, and most likely there's going to be a rib hump there. All the signs of a possible scoliosis in the torso or the thoracic spine. Now, if you look at the middle picture, it's very different. There's an imbalance or an asymmetry in the lower part now we're looking at of the spine. So number three indicates that there's a bend in the spine to the left side. You may or may not see that, but there's a bend to the left there. Number four, you see the right hip is higher than the left side. So that right hip is hitched up. Number five, in the right picture, you see the waist crease in there. So there's a crease actually in that right waist area there. So it's flat on the left and it's more curved on the right. So the gold standard test is what's called the Adams test, or the forward bending test. So number one, you see on the left picture, there is the bones are sticking up, or the right side is much higher than the left side. Okay, so in that left picture, you're seeing the ribs on the right side literally sticking up or out. And on the right picture, this is now the lower back. As you bend a little bit further, now you see the lower back hump there. The lower back looks like the muscles are bigger on the one side, and it tells us there's rotation in the spine on that side, and there truly is a scoliosis that we need to investigate. So we have the instructions there for you for an Adams test. We will go over this more formally as well in a minute. But you put the feet together, you bend forward with the knees straight, you let the arms dangle with the palms together, and you just bend even lower to be able to check out that lumbar or lower back area. The spine will curve toward the side that's high or humped or sticking out. So if we see this, we don't want to wait. The earlier, the better to get the best outcomes. So here's the Scoliosis screen. So this is something you can Google. New technologies are now at play in analyzing these things. There's at-home screenings that you can do. So I definitely want to show you this today. So there's an app now called Scoliosis Screen. It's web-based and it's free. You're looking at your loved one, and then you're comparing it from behind, and then you're comparing it to the screen and the prompts that it's giving you. It's used as a guide and also gives what's called a risk analysis. So you can use a phone, a tablet, or a computer. You open the Scoliosis screen, and then you follow the prompts. Okay, so you stand behind the person, and you make sure you can clearly see their back, the shoulders, and the waist. You look at the shoulders, then you compare it to the screen on your phone or tablet, and you select the most appropriate answer. Then you look at the waist and the hips, and you compare it, select the answer. Okay, you have them do the forward bend or the Adams test, and looking at the rib cage and lower back, and then you select the comparative answer. You answer the final questions, then submit, and you get a possible risk score that will be given to you. Now you can also, at the end, you may add, if you wish, you can add your location to connect you to a qualified scoliosis clinician in your area. Okay. So we do have a video here. Let me just take a minute to get this fired up here. Okay, so we'll get this going. So this is a video of the Scoliosis Screen app itself. Okay, so I hope that was helpful. So these are the features, again, that the app can perform for you. So they'll ask you to check and compare looking at the shoulders, the waist, the hips. Is there a noticeable curve in the spine that you're seeing? Have the person bend forward, and is there a family history? You can answer that question. And if the person is male or female. And again, females have a higher risk in developing, especially in teenagers and in adults as well. The females have a higher risk in teenagers and in adults after menopause. And then it gives you a risk profile. It can't tell you, if it's a true scoliosis or not. Only a qualified clinician can do this, but a qualified clinician like myself can use an actual tool called a scoliometer, and we offer evaluation of the three-dimensional, it's called a brace scan technology that's being used today. And then there's the standing weight-bearing gravity-based x-rays that are necessary as well for the full assessment. But the app did show a 70% agreement between the Scoli screen and a clinician that it was a scoliosis. And so you can check the children, the grandchildren, check each other, send it to friends or family, and maybe have them do this as well. So why is it so important? So this is an x-ray, 3 x-rays here. The one on the left, this is an x-ray of a person's lower back and hip areas. So it's normal on the left. The hips and the pelvis are somewhat level, and the lower back is straight. So you can see there's a straight spine there looking from behind. The vertebrae are all stacked in a straight vertical line. The middle x-ray shows a bend or the curve to the right, looking from behind. A scoliosis that is mild, but we certainly want to detect it here and do something about it when it's like this. It's more correctable and may not need to use something like a scoliosis brace. But unfortunately, the x-ray on the right is when we see many scoliosis coming in far too often, needing a brace or even surgery, unfortunately. But we want to avoid surgery, right? So get it into a position that's stable. So again, picking it up in the middle x-ray would be the best before it actually worsens. So what about treatment? So treatment options, when we present treatment options, we have to look at the evidence and the research. Certainly today, much more interesting and accurate outcomes are being reached here. So in smaller postural curves where the scoliosis is less than 20 degrees, treatment will be needed and should always be checked and monitored with a scoliosis clinician. Now, when the scoliosis is larger than 20 degrees, it is important to have a more thorough assessment by a scoliosis clinician, and may have to use a scoliosis brace as well, which is much less difficult than going the road of surgery, correct? So each case is different and requires expert assessment and the right treatment. Treatment types will depend on the person's age, stage, and type of scoliosis. Research has shown that the non-surgical treatment options of chiropractic scoliosis specific adjustments and exercise, 3D dimensional custom scoliosis bracing if necessary, have the most documented benefits and is highly effective. So what does some of the research say? I'll go over a few of these with you. If you wear a scoliosis brace more than 13 hours a day, now it's different for every case, but let's say you wore it more than 13 hours a day, 90% success in stopping you from having surgery. Bracing is an effective treatment method for AIS cases. That means adolescent idiopathic scoliosis cases. That's the adolescent ones, characterized by positive long-term outcomes. Conservative treatment with a brace is highly effective in treating juvenile, that's that 3 to 10 age group, idiopathic scoliosis, with most patients reaching a complete curve correction. When specialized scoliosis active correction exercises, called CS exercise, which stands for, has been used in conjunction with bracing, it has improved the results of the hard bracing. Part-time bracing in adults significantly reduces progression of the curvatures and improves quality of life. So here's some more examples for you. Let's go to the left picture here on the left. A 13-year-old patient with a 33-degree Cobb angle or scoliosis. So again, we're looking from behind. So that is a 33-degree bend between their mid and lower back, a thoracolumbar scoliosis, bending to the left side. Now, we see the person without the x-ray in the second picture from the left there. You see the postural assessment that we do. And so you can see the posture is also showing the same thing that the x-ray, but the x-ray is much more accurate, right? And then third picture from the left. The patient is in a Scoli brace, which uses an over-corrective approach. This is a full spine brace. And what's neat about this, you're seeing a white brace there, but it has all kinds of different designs and real cool designs that you can put on them, different colors and things like that. But it's a full spine, three-dimensional brace, which means that we're addressing, again, the side view, the front and back view, and the rotations that are inherent within a scoliosis. This is custom made. It's called a mirror image. You go the opposite direction of the scoliosis. It is 3 dimensions. So in the case of an adolescent, as they grow, you want them to have them grow their spine straighter, right? So it's like braces on the teeth, straightening the braces, straightening the brace, straightens the spine, like the teeth. And then the one second from the right. A postural assessment done after 12 months of treatment. The shoulders are much even. The back is straighter. The hips are more level. And more importantly than the cosmetic or the aesthetic changes, how it looks, they have a better future. They're not worsening. They have just greater self-esteem, typically, especially in the younger ones. Less pain, not degenerating. They have greater stability. Now, in the adults, it's a little different. It's more about, certainly can be about how they look as well, but it's more about the stabilizing the spine, stopping it from getting worse, slowing down degeneration, helping pain, and improving quality of life. So in this case, we're looking at, they're down to 6 degrees. This was after 22 months of treatment, down to 6 degrees from 33 degrees. Amazing result. Now, this can even happen in little young ones. So look at a 3-year-old patient with a 40-degree bend in their spine. And that's the initial postural assessment. The x-ray shows it much more dramatically than the posture does. And then you see a traditional brace. So there's been many braces used over the last many years. It has not really changed too much over the years until the Scoli brace came along. And so this is what's called a traditional or hospital brace. And we see that even in the brace, it's still showing a 33-degree curve while they're even wearing the brace. So it's not doing a whole lot there. And then you see the next picture, looking from the front, a patient in a Scoli brace, which uses an overcorrective 3-dimensional approach. Now, this person is also wearing a body sock or like a thin t-shirt underneath the brace. And then what you can do is you wear your clothes over the brace. And then the result there with the Scoli brace, the improvement out of the brace of 26 degrees from 40 to 14 degrees in a growing spine after 24 months of treatment. So the way forward. So parents, grandparents can check children and each other for scoliosis. You have a way to do that. ScoliCare has certified healthcare professionals like myself around the world with extra training in assessment and the treatment for scoliosis. If it is picked up early, scoliosis can be very effectively treated with the new generation of scoliosis, 3D assessments, and scoliosis bracing. Even for adults, detection and treatment can, again, improve pain, stability, mobility, aesthetics, and quality of life. So anytime is a great time to start checking your family for scoliosis. Children, grandchildren, adults, grandparents. If you find something, get them assessed by a qualified scoliosis clinician like myself. To avoid surgery, the most important thing is that the patient receives the right treatment at the right time. Okay, so as we get our teeth checked, our blood pressure, we get cholesterol checked, we get all these things checked, routinely. We also believe it's vital to get our spine and nervous system checked as well, especially if you have a possible scoliosis. So again, part of our mission is to offer an opportunity, okay? Not for broad stroke solutions when it comes to your health, but to know your individual issues, your needs, your goals, specific to your age, your family history, and then kind of put it all together for you to offer the best solutions. So the offer we have for you today includes a consultation, an examination, standing spinal x-rays, all the testing needed, and a second visit as well. All of it normally around $175, okay? But we give you a special offer for that. There's two obstacles that we sometimes face. The cost is one, but the offer eliminates that. Procrastination is the other. People put things off, and it's certainly recommended not to put things off if there's a possible scoliosis there. And so there's our offer. Now, again, just to let you know, with the COVID, we do have provincial guidelines in place. All treatment rooms are sanitized, so we are following all the provincial guidelines just to, know that you can feel safe. So finally, you have two choices for your consultation. Okay. You can attend an in-office appointment. Okay. So the in-office appointment is the consult, the exam, the x-ray, the second visit. Again, we are fully open, following all the health guidelines. So that's one way. That's probably the best way to do it, is just click on the link to reserve that appointment directly in the office. We also can do virtual consultations as well. I can do a free 10-minute video consult, speak to you, or again, just make an appointment to come into the office. We are located in Tecumseh. We have patients from across Windsor and Essex County, across the region actually. So again, click the link to reserve your appointment. We'll be in touch. We appreciate you coming online here and hearing this information. And if you have any questions, if there's any questions about appointments, you're certainly welcome to call our office as well, Not a Chiropractic, in Tecumseh, Ontario. So have a great day, everybody.